Thank you very much for joining us today. I see it's 1 minute after the hour, which means it's time for us to start. And Carissa, thank you for continuing to admit people into the webinar. I'll just start again with housekeeping. For those of you that have just joined us, this webinar will be available, the recording as well as the soundtrack. We will send it out afterwards and make it available for you to share with anybody that hasn't been able to join us today. And therefore, I will start. I'm Ingrid Jarrett, President and CEO of the BC Hotel Association. I'm delighted to be here with Christopher Nicholson, President and CEO of the Canada West Ski Area Association. And also we have Mike McLeod, our Director of Member and Business Development with the BC Hotel Association. Mike, would you like to introduce Stephanie?
Thank you very much, and thanks for joining us today. I wanted to also mention, although she will not be presenting, we have Stephanie Alalou from GoToHR. Stephanie is the Manager of Industrial Health and Safety for GoToHR and a terrific resource for those technical type questions. And we will refer to Stephanie if there are questions towards the end. So welcome, Stephanie. Ingrid, back to you for the presentation.
Thank you very much. Oh, I'm just getting my control going here. Oh. So here's by way of introduction is Ingrid and Mike. We're both very pleased to be here co-hosting the webinar and have been committed over the last many months developing the best practices and protocols and making sure that we are keeping completely aligned in real time with the Ministry of Health orders, and have certainly done a lot of work with many of you from our industry to ensure that we're providing you best practices and protocols. So as we're looking to the ski season coming up, we're all excited about having many months of great skiing. We understand there's going to be lots of snow. So the learning that we've done between the beginning of the pandemic and now, we're hoping will be very helpful for you in your opening. We've done our best to include within the slide deck the key areas that we can focus on to ensure that you have the information that you need. So first and foremost is communication. When you're thinking about taking your reservations, what your website looks like, the actual pieces of information that you have for your people that are checking people in and out, what you have from a collateral perspective within your guest room, the signage in your lobbies or on your doors around whether or not somebody needs to wear a mask and where the spacing is for physical distancing, where your hand sanitizer is. All of that you really need to evaluate and make sure that it is compliant. So first and foremost, your protocols need to be on your website. They need to be within the reservation platform of your website. Your confirmation emails, your pre-arrival emails, your telephone recording, again, your in-room collateral, your public space signage, your food and beverage signage, your check-in communication. And those are the key drivers within PHO that says, do not travel if you're not feeling well. Have you been out of the country? Have you been exposed to anybody with COVID? And people need to commit at reservation time as well as at check-in time that in fact the answer to those questions are no. And if you go through this list and you're making sure that the information and the way that you're expecting people to act and react is clearly communicated, then you're in a really, really good starting place. Along with that are the different departments that potentially this year would be different than last year. That may include valet parking or no valet parking this year. No bell service. People may be carrying their own bags to their rooms. There may be in-room dining limitations, or sometimes in some properties there may not be a restaurant open as often as it would have been historically, and that they actually do more in-room dining. And if you do in-room dining, they need to know that you're leaving that tray or that delivery at the door. The other thing is a safety plan, and you developing that safety plan with your health and safety committee, and making sure that your teams in all departments are engaged in developing that. So here is our our partners with Go2HR and WorkSafeBC have developed, there's really a 4-step process to develop your safety plan. One is eliminating the risk, and that is the first thing that you need to do to make sure. And then part of that is what I just spoke to, is making sure that nobody arrives not feeling well to the resort. The next level is engineering controls. If you can't always maintain physical distancing, this is where you look at installing barriers. Plexiglass, for example, is a very common barrier that ensures that the teams at work and the public coming in actually have a barrier to remove. The next one is administrative controls. This is saying only so many people can be in this area at any time, and actually managing the number of people that can come in. And you can do that by circles on the floor, or by actually one of your team members ensuring that they've got the guest count in a public space. The other thing of it is maybe potentially in your lobby areas, you have a different configuration for your furniture so that you don't just have groups coming and gathering and sitting together. And then the fourth one is, of course, your PPE, and that is your masks. And it's important that you have a protocol that is clearly communicated. Many areas currently are saying masks are always worn in public spaces, and that will be up to the ski resorts and the properties themselves to determine that. It is not currently mandated in British Columbia, but it certainly is recommended. And it is a way that you can make sure that people are physical distancing, and then they have the additional barrier of wearing a face mask in public spaces. So creating your safety plan. Here are some of the things that needed to be included in the safety plan. One is a sick leave policy. You need to really think about it. If somebody comes down with a cold, and communicating what is the difference between a cold and a flu and COVID-19, you know, how you need to honor to allow them to stay home. Do you have a sick policy? And what does that look like? Also, the personal hygiene policy. What about working alone? And then what about bullying and harassment policies? Now, all of this information is available for you on Go2HR, and it's also available on the BCHA website. And certainly there are teams of people that are available to assist you in developing these kind of policy plans that would be included in your onboarding or your hiring procedure and the onboard training. Mike, over to you.
Perfect, and thanks, Ingrid. Just wanted to make a quick mention on the safety plan issue. We certainly heard from operators, particularly in some of the resort areas this summer, that there was definitely inspections going on, and some of it was inconsistent, to be candid. So often we were hearing they received multiple inspections from WorkSafeBC or Ministry of Health. Others only reported hearing from them once or seeing them once. So just expect that there will be inspections. And the comments on safety plans really are not to call anybody out, but we want to make sure that everyone has some version of a safety plan, and Go2HR is a great resource to get that started. To go along with the safety, as well as keeping your staff, employees safe, really is monitoring what's going on in your workplace. And this is as important for our associates and employees as it is for building guest confidence, because I think as we continue to see challenges with increasing caseloads here in BC, consumer confidence and building that, continue to assure our guests that it is a safe environment for them to visit, to bring their families and stay hopefully for an extended period. We want to make sure we're sending them away with a great feeling. As well, we want to take care of our employees. So that involves all of you as leaders, you know, making sure we have effective supervision, that your checklist and reporting is up to speed, that employee contact information is kept valid. Again, I know we are dealing in a lot of cases with employees that a new influx of employees that are coming on board. We want to make sure we take that extra time to gather the pertinent contact details right away and keep it up to date, because as people shift around or change residences during the season, that sort of thing, we want to make sure we can get in touch with them.
You know, historically, our industry would have prided itself in making sure that all of that magic of cleanliness and the cleaning of the washrooms and the public spaces and everything else was done, and you hardly even noticed that anybody was doing it. Now the absolute opposite is appropriate. So making sure that how many times you clean the washroom and how many times you clean the public space or the railing or the doorknobs or that kind of thing, you need to keep track of that. And those checklists and reports are part of the WorkSafeBC checklist. So when they come in and they inspect, they'll want to be seeing that. And you definitely need to make sure that that employee contact is for traceability and that those records are kept.
I should say too that just to add on to that, to go back to the communication piece that Ingrid kicked off the presentation with, it's perfectly fine to communicate how often you are cleaning public spaces or cleaning restrooms, those types of things. Again, it's really in the interest of guest assurance and guest confidence. I did see a question come in previous to the presentation starting, and a best practice for public spaces, and I know we're going to move to that slide next, is as best you can clean every 60 minutes during your typical operation hours. Switching gears a little bit to public spaces. And so we know that, especially in the ski industry, there are certain choke points and congregation points, particularly before and after people head out to the hills. We also know that many of you have spas or hot tubs or even pools. And of course, food and beverage locations where there may be, it may be difficult to control guests congregating and just the capacity of guests. So we're going to talk a little bit about that. As we have been mentioning, and as you probably have noticed from if you've read the protocols, the physical distancing piece is first and foremost. We want to make sure that if we have areas that are choke points within our buildings or properties, that we are controlling those with signage as best we can. We're controlling entrances and exits, as best we can. And that if physical distancing is not available, we would highly encourage the use of masks, both obviously for your employees, but for guests as well. And if necessary, and we've seen this again throughout the summer operating season, do not hesitate to institute scheduling if necessary, especially for things like hot tubs and spas, pools. It has worked well in various places around the province in the summertime, and we can certainly, if you have specific questions about that, we'd be happy to put you in touch with those operators and they can talk you through how that went. Again, it comes back to the communication piece. So let your guests know in advance what's happening and what to expect, and that will help through a variety of these situations that you're going to come across this winter.
Yeah. Thank you, Mike. So with the entrance and exit, it's important to note that one door in, a different door out. And that really ensures that you're not passing each other without that physical distancing in a compressed space. We do have many questions about the safety of hot tubs and pools from a chemical balance perspective and whether or not the water itself is a risk. And both the provincial health and the BC CDC have confirmed it's not the actual being in the water there's any concern, because of course that is balanced according to provincial health orders with chemicals. It's actually, again, the physical distancing, which is why we are encouraging people to keep a schedule. So when somebody checks in, they've got a time slot and you can tell them between this time and this time, their group can go in the hot tub or can access the pool, and managing that so that there isn't any compression without physical distancing, and managing how many people are on the surrounding areas is what's most important. So we have some details here around housekeeping, lots of questions about housekeeping. So what is different this year than last year? Number one, no stayover service. So again, this is a really important piece of communication that you would include in your reservation confirmation, in your pre-arrival. And it also means that tracking how many people are going to be in the room and how much linen they actually need is something that you can do prior to arrival. We definitely say a full supply of guest needs prior to their stay, because you won't be housekeeping during their stay. Communicate in the room. What is the process if they do need a towel switch over? And then what about garbage pickup and things like that, that your stay over service would have historically looked after? Dropping off needed supplies at the door is the recommendation. And we've seen properties that have two different colors of bags, for example. One is for dirty linen that you then replace with one outside the door, and the other one is for waste collection at the door. And I think that process we've seen has actually worked very well. After the guest stay, if you have windows that open, it is recommended to open the window. Air exchange between stays is certainly something that is recommended. The housekeeping team coming in should be wearing personal protective equipment, which would be, of course, a mask, using disinfectant that has the drug identification number on it, and then complete a thorough cleaning and disinfectant of all hard surfaces and discarding whatever items may have been used. Certainly with kitchens, washing all the, the utensils and, everything that somebody would have used within a kitchen. Now, just to note, all of this information is in our best practices and protocols on our website. We did have a question prior to the webinar that we thought we would include a whole slide, because everybody will be wondering about this. What if you have to isolate a guest during the stay? So thank you to our partners at Go2HR. We had a discussion around if we were going to put together a protocol for you, what would that look like? And this is the recommendation between the organizations. Firstly, you have to think about making sure that somebody does not arrive ill. So that I've referred to earlier. And then if somebody for some reason is not feeling well, they need to dial 811. And then that hotline will actually give them the advice to proceed. If a guest is confirmed, keeping in mind there's often a period of time between testing and confirmation, I would suggest if they're using their own vehicle that they should return home in their vehicle as long as symptoms are not severe, and get tested in the place of residence versus get tested where they're on vacation. Certainly they need to wear masks wherever they go on their way home. If they need to take public transportation, which includes transfers, flights, and public transit to return to their residence, then they will not be able to return and will have to test locally and isolate in their room until they get their results. As soon as somebody believes that they may have COVID and they're going for testing, they need to go to their room and they need to stay there until they get their results. If their results are positive, they will have to stay there for the quarantine time frame of 14 days. At any time, the local health authority is there for all of us as advice and for help. Anytime something happens and you're not quite sure what to do, they are your best resource, and we do encourage you to call them and reach out to them. If for any reason there's a staff member that may have come in close contact with a guest who has tested positive, and we all hope that this is a very, very remote possibility, we need to make sure that we take the same care and that they isolate as well. Again, that staff member should call 811 and follow the procedures. Deep cleaning all the areas that the affected guests would have stayed in after their stay when they've departed is very important. Clear communication on the website and during check-in, again, going back to avoid the surprises. And you really need to emphasize that guests should not travel if they're feeling unwell. And that's where that check-in stop with that conversation, where they have to actually sign in compliance that none of those risk factors are in fact arriving with them. And you should definitely be looking at your cancellation and refund policy and make sure that that also is communicated very clearly. Mike, would you like to go through the detail of the WorkSafeBC inspection? You referred to it earlier.
Thanks, Ingrid. Yeah, as I referred to earlier, we certainly heard about inspections taking place sporadically and inconsistently throughout the summer period. So please be prepared that you will get inspected and maybe multiple times. The crux of the WorkSafeBC inspection process really goes back to creating a safety plan, having evidence of implementation. So working through the guidelines and protocols that we've outlined already, ensuring that those have been implemented and that you can show that easily. Demonstration that the employees understand the procedures. So that goes to your onboarding and your training, as well as your communication and regular check-ins with employee groups to ensure that their knowledge is up to speed. Again, it's as much for their safety, for your safety, as well as the guest confidence. We want to encourage guests to come multiple times to your properties or see as many of the ski resorts around the province, and we want to make sure that we're building that confidence. And of course, focusing on the hygiene elements that we've come to know and love through this pandemic. Switching gears, we're going to move to talk a little bit about gatherings and events and guidance around that. So this really would refer to groups and or meal services. We wanted to include this because we know there are properties out there that are looking to be able to handle capacities, particularly at the high volume parts of the season, Christmas, New Year's, Family Day, those types of weeks. And you may be looking to repurpose meeting space or group space to be able to service meals, because we of course have limited capacity in our restaurants and bars as well. So that becomes a double whammy. So on the BCHA website, in the COVID-19 area, you will find the most recent public health orders relating to gatherings and events. That's one order. And also how to effectively manage your restaurant or licensed premises. And that's a second order. And they're slightly different. There are some nuances to it, but the resources are there. If you are looking at repurposing conference space or meeting space to be used as food and beverage service to handle capacities, we've confirmed with the Ministry of Health that is okay to invoke the restaurant guidelines in your licensed conference space. So if you have a licensed meeting room or a conference ballroom or something along those lines, you can actually use it as a restaurant if need be, as long as you're following the restaurant public health orders. Again, those are available on our COVID-19 page on bcha.com. There are some key elements to ensuring that process is smooth, and they're outlined on the screen at the moment. But ensuring there's a reservations process, clear seating and entrance and exit points, and we'll show an example here in a moment on that. That you are adhering to the service standards. So beverage service, for instance, there's no self-service. You may need to, if you've normally run a buffet or something along those lines, you would have to serve the guests rather than the guests using utensils themselves, those types of things from a service perspective. Entertainment needs to have that physical separation, either behind plexiglass or enough physical distancing if you plan to have entertainment in a situation like that. Dancing was unfortunately recently updated as a no-no in event space. It has long been a no-no in bars or lounges or that sort of thing, but it's now been updated very recently last week to include conference space. So you can have entertainment, you just can't have the dancing piece. On the street.
Mike, allow me just to make sure that we're really clear. This is for hotel specific conference rooms.
Correct. Not
freestanding banquet halls or community halls or any other space that is not a purpose-built convention space in a hotel. And that is very important, the differentiation, because within the PHO best practice guideline that you will find in the latest order, it stipulates the difference between those freestanding spaces that historically we may have had entertainment or events, you think about wine tasting events or any of those other things that we've had historically. That list of protocols and processes does not apply to those kind of spaces. It only applies to a hotel specific conference room.
Thanks for the clarification, Ingrid. That's great. On the screen now, you see an example of a floor plan. This is a real life example from a ski resort property in this province. And they've taken the time to outline their plan, their floor plan for restaurant style service in their meeting space. And you can clearly see on the floor plan, there's a lot going on there, but you can see clearly that there's clearly marked entrances and exits, directional arrows of where guests are expected to walk and how they can come and go to the various tables. You see the sanitization stations in various points around the room as well. So it's a very well thought out plan, and we just wanted to encourage you that you don't have to sort of wrestle with how are we going to feed everybody through our restaurant at reduced 50% capacities when you may have additional space that you can repurpose and use and take advantage of those health orders as they're meant to be applied. We're kind of rounding out the formal presentation part, so we will get to feedback in the forum and some questions in a moment. But I just wanted to reiterate that all of the resources are available on our COVID-19 recovery guidelines page. The link is there, or you can easily navigate it by just going to the bcha.com homepage. These links will be included in the recording of this on the website a little bit later on today. We do have a resource recovery guide. So if you are, for example, just getting started or just getting reopened, you may not have opened since we all closed down in mid-March, and you're looking to potentially purchase some last minute PPE or looking for sanitizers or that sort of thing, that is all included in the recovery resource guide. So there's suppliers that you can access that can give you a good pricing on that information, on those materials, and get it to you fairly quickly. There's also some pretty good eco-friendly options, especially in the world of hand sanitizers and that sort of thing. I know that is of some appeal to this group. And finally, we do want to make sure that you find out about membership of BCHA. We've been working very closely with Christopher and Canada West here for the last little while, and there's certainly some great programs you can take advantage of, whether it's group purchasing agreements, insurance. I know that's a hot topic these days, and other benefit programs that we provide, as well as education like we're doing today. And we've got a great training series coming up on financial leadership this fall and early winter. So we invite you to find out more about membership at bcha.com/memberbenefits. And now we go to the question
We
part.
actually had all kinds of questions, so thank you for that. We've chosen a few that were asked more than once. And we also encourage you to use the chat function at the bottom of your screen if you have questions that we haven't answered or that you're dying to ask in real time. So the first one is, how frequently are most places cleaning restrooms, elevators, and high-touch surfaces? I think we covered this, a minimum of once per hour. The more, the better, especially depending on how many people you have going through spaces at any given time. Mike, would you like to take this one?
Sure. We had a general question about disinfection of gear, helmets and boots and goggles and those types of items. The short answer on this is please use your approved cleaning disinfectants. That's the safest way, the quickest way to ensure that you're disinfecting that equipment effectively. Just about all the products that I mentioned that we have available on our resource page will be safe for this equipment, and really just ensure that you are taking the opportunity to every time gear comes in or gear goes out that is disinfected, and just use your disinfecting hand sanitizers and disinfectants as you need.
I think we touched on any specific rules, tips for food service and spaces. It's really important that anybody that has a restaurant or a food service actually reads in detail the protocols on the best practices. We, right at the beginning of March, did a lot of work with the BC Restaurant and Food Services Association and Restaurants Canada and Able BC around liquor service, food service, best practices and protocols, and it's all in there as a guide for you. It's very important that you familiarize yourself with it. And when you're training your team, that they also are trained so that they have an understanding that they're actually serving in a very safe way, and that they can actually recognize a risk when and if it arrives. If you follow these protocols, we've been serving, you think of between March and today and all the food services that have been going on in British Columbia, there has been a minuscule number of cases within a food and beverage operation or within a hotel. And the reason for that outcome is because of the work and the adherence to the best practices and protocols that we've worked with the Ministry on Health for. So those guidelines are actually orders, and they need to be adhered to, and you need to be familiar. So we're here as a resource to support you in any way you need, but we really encourage you, make sure that you and your team understand it firsthand. And an open forum here. I'll just stop sharing, and Mike, or we'll go to see if there's any questions in the chat.
Yeah, I've got a couple of questions here, Ingrid. First would be, we spoke about the gathering and events protocol, but would you like to speak to the private gatherings? And there was also some related questions to how many occupants should be in guest rooms.
Okay, great. Those are both really good questions. So my interpretation of the private gatherings is, what about if somebody rents a suite on a ski resort and they would like to have a dinner party? And so I'm going to answer the question that's what that private gathering question was. And if not, please make sure you clarify it for me. Currently, there is a 6-person limit, which means if you have a suite that is a 2-bedroom suite and you have 2 people per bed, that's 4 people, and you can have 6 additional guests. That means 10 people. But currently, with the change in the second wave, that number is recommended to be 6. So if you are a family unit and you're coming to a ski resort together as a family, you can stay in that pod as a family, even if it's more than that, because you're a pod. But in order to have private gatherings within a suite at a ski resort or anywhere else in the province, the numbers are limited to 6 people in addition. And the second part of your question, Mike?
I think that was you covered both of those there. Kind of related, but a little bit of a different angle is, are we aware of any policies regarding shared staff accommodations?
Shared staff accommodations. Okay, this is perfect. We actually have best practices and protocols for every configuration of accommodation that is fixed roof. The only thing we do not have our policies and best practices for is short-term rentals, which would be Airbnb or VRBO. So whether or not you're a hostel, which would actually be completely compliant with shared spaces for staff accommodation, depending on configuration. Within the best practices and protocols, you can look at motels, bed and breakfasts, lodges, inns, campgrounds, hostels, shared accommodation. So the detail is there. And there is distancing between beds. There's dividers. There's all the details that you would need to make sure that you're compliant with a shared staff accommodation.
Terrific. We have a question here regarding travel insurance. We are suggesting each guest purchase this to make the guest comfortable with booking a unit. Would you suggest we make this travel insurance mandatory?
Wow, what a question. I wouldn't, I mean, as a business operator, I wouldn't suggest it. There's nothing wrong with suggesting, have you considered travel insurance? I'm not aware. I do know that there is COVID travel insurance for people who are going south or people on big holidays or, you know, whatever that they're doing. I think it's a personal responsibility to determine whether or not you're buying insurance. You have the right to suggest that they have it. I'm not sure why, as an operator, you would be asking that unless you felt that the insurance would cover them should they become ill and should they cover the 2-week stay and the cost of that from a room rate perspective. But I think what many hotels and accommodators and resorts are currently doing is indicating that should somebody have to isolate within the property for whatever reason, that they in fact are responsible and that they agree to paying that room rent. Now, whether that comes from an insurance policy or whether that comes from the person renting the room, as an operator, as long as you're clear about that, then I think you're, you know, you've done due diligence.
So we had a couple of questions in the same regard, and maybe I'll handle these two, Ingrid, and really relates to should we, or is there value in blocking hotel rooms for 24 hours between guests? And is there recommended preferred rest period between guests? And to Ingrid's point a second ago about the insurance question and those potential situations where you may have guests that need to stay longer. In regards to blocking hotel rooms between guests, you may, you probably don't need to block rooms for 24 hours. You definitely do not need to do that from a safety point of view. However, you may want to consider ensuring that you leave yourself wiggle room in case of incidents like we've been referring to, whether guests need to isolate and that sort of thing. Just give yourself the space to be able to operate, particularly during the high peak demand time periods. We all know everybody wants to make the most out of the season, and there's definitely challenging economic conditions out there, but we want to make sure that you leave yourselves the opportunity to adjust if you have a situation arise where guests need to stay, they can't get home, those types of things. And a little bit more specifically about the check-in, check-out period between guests. Previously, in the initial protocols that were released way back in the springtime, there was a 3-hour wait period that they were suggesting. That has been removed. So as long as you can complete your proper cleaning safety protocols from when a guest departs and a guest checks in, you do not need to wait that 3 hours. It's just a guideline, but you need to make sure that you've gone through all your touch points from a housekeeping and cleanliness point of view.
Yeah, and you know, I can add a little bit to that. You know, there's been an increasing understanding of this virus, and there was concern in the beginning around airflow with configurations of properties, which is why I referred to, if you have a window to open when you're cleaning the room, open the window. And it's for comfort for the cleaning team, as well as making sure that there is that air exchange within the property or within the suite. But the other thing is, it also has shown that with the approved cleaning products on surfaces, that it only lives for so long. So there isn't a risk like it was originally thought in the spring. So that's why that waiting period, in fact, was removed by the BC CDC and the Ministry of Health. Just in case anybody's worried about that.
And time for one or two more questions here. We received this question earlier, and some of you may see it in the chat. Do you have suggestions on how our teams can handle COVID doubters/deniers? It is difficult to request guests to follow protocols if they do not believe in the risk. I think we've referred to it early and often in this presentation, but you will be doing yourselves a tremendous favor if you take every opportunity to communicate the guest expectation before they get on a plane or before they get in their cars to come and visit you. And as Ingrid outlined so nicely through the early slide there, every touch point you have in relation to your guests, take advantage of that to ensure that you're communicating your expectations as well as what your protocols are. That will help you out down the road. We definitely have heard, and those who were in operation in the summer, the reports from the field were that this is a real issue. You know, there are definitely guests that are a little more challenging and feel like the rules don't apply to them, and they're on vacation, and you can't kind of interfere with that time and that sort of thing. So be prepared for it. We're not going to say that it's not going to happen, because again, we heard frequently from around the province this summer that this was going on. And we want to make sure you're prepared, but the best thing you can do is communicate in advance, up to and including what the moment they arrive.
You know, the other thing that I would suggest is, as a business owner, we have always, and being in the service industry, you know, we're in the industry of people, and we're in the industry of people having fun. Whether you're skiing or you're in a restaurant or you're staying in a beautiful at a ski resort, and we will always have to deal with all kinds of different people. So communication first is key. Communicating and supporting your teams is key. And then making sure that you're training on how to deal with these difficult situations. And I just really want to take a moment to acknowledge the work and the training that our partners at Go2HR have done on dealing with difficult people and difficult circumstances. And I'll just highlight a couple of the things that we hear most often. One is in food and beverage, and that is, there is a rule in food and beverage that, you know, you can only have 6 people at a table. Once you get to your table, you have to stay at your table. There's none of this table hopping. You know, you can't pick up your glass of wine and go meet a bunch of new friends at different tables, which historically would have been sort of part of our social, you know, why do you go to a pub or why do you go to a certain place? That's what you used to do. So clear communication. This is your table. You must stay at your table. There is no going to other tables or interfering with other people that are sitting at different tables. And then, of course, you need to have a little bit of bench strength, which we've always had as well in case people misbehaved in one way or another. I would strongly suggest to, if you have concerns, that you reach out to Go2 and that they would assist you with the training so your team is confident and they have the tools by which to deal with difficult people. There will be difficult people, and at the end of the day, if you have communicated the rules and they're checking into your hotel and you have confirmed them and they've signed off, you have a lot more credence when it comes to, you know, your security guard saying to them, I'm sorry, you have too many people in your room. You either fix this now or off you go. And, you know, history, we used to have to do that and take it into our own hands historically. And I think we may well have a couple of situations like that in the future, but we need to make sure that people have the tools to deal with it. It's really difficult, but it's not impossible. I think we have a couple more questions here, Mike.
I believe there, Christopher, thank you for a couple of notes in there for the group chat on COVID world presentations that Go2HR is presenting.
Yeah, you know, I can say as an industry, those of you on the call that are looking forward to the winter, and, you know, there's lots of apprehension because it feels like a different landscape than it did last winter or the winter before. And I would suggest that, you know, not only do we have the information of the ski resorts in the summer hemisphere, and I know Christopher and his team have been closely in touch with them, as many of you operators have, but we also now have 8 months of operating safely from an accommodator perspective, from a food and beverage perspective. We know so much more now than we did 9 or 8 months ago. And, you know, the partnerships that we have between Canada's West, BCHA, Go2HR, and I could name several more, ABLE, Restaurants Canada, BCRFA. We have all been working hard on your behalf to make sure that what we learned in closing all those properties down and then opening them up again, all of those tools are there and they are there for you to use. So whether or not you're opening something up that has been closed for 6 months or something, and some of you would have been open part-time in the summer, please make sure that you use the resources that we've garnered on your behalf, and they rest on our website, bcha.com. And we're really looking forward to a great winter of skiing, and we're looking forward to being able to say that we operated safely and that we were really responsible, and that in fact, it's safe to ski and to have a great winter season, even during a pandemic, because we've certainly been able to say that in the way that we've operated so far with the spring and the summer and this fall. So that's my wish for all of you. And please don't be shy. We're here for you. We'll give you and help you. If we don't have the answer, we'll find it out. So Christopher, thank you very much. I think
Well, thank you to Ingrid and Mike. Fantastic information yet again, and for not just this session, but the whole series with BC Hotels Association, certainly on behalf of all the operators within Canada West, really appreciate it. And just to reinforce something Mike said earlier, for the ski operators on the line, please do look at the BCHA website. If it sounds like I'm pitching something, I am. There's a lot of great value, and certainly one of those areas around the group buying programs. Really take a look at it, because that can have a huge impact to your bottom line. So thank you again to BCHA. Really appreciate all the great content and the super partnership.
Great. Thanks so much, Christopher. Thanks,
you. Christopher. Thanks, everybody. Good luck this season.
Okay.